I welcome Rajesh Lalchandani sir for this podcast. This podcast is dedicated for the challenge which I'm taking for the Kaggle to solve the melanoma challenge. And I would love Rajesh Lalchandani sir to introduce about himself in this podcast. Sir, over to you.
Yeah, hi. I'm Dr. Rajesh Lalchandani, an aesthetic family physician, and I've done my studies from Mumbai as an MBBS and my post graduation from Ilamed. And I'm also practicing from the last 10 years. I've been associated with companies like Glenmark in cosmetology, Allergan, and Merz Aesthetics as medical head. And now I'm a consultant to Dr. Reddy's Laboratories for the new brand of bottom toxin known as Nabota. And also, I'm a consultant to the naturalminds.in because it's a EMR software known as Spotcare, it's IPCP, it's an intelligence software. Also, I'm specializing in artificial and intelligence and machine learning in healthcare from Edurega. And probably I understand the role of machines and a role of IIT in the medical field, which is changing very quickly, and we need to get upgraded with that very soon because doctors should handle the machines and machines should not handle the doctors.
That's true.
And my last qualification last year I was in Harvard University for my accreditation program. It's the AMA PRA accreditation for my bottom toxin and aesthetic and movement disorder facilitator program in Harvard University, which was a CME course which I attended last year in October. I was present at Harvard and MIT, and I was the only one from India.
Yeah, it's very nice to have you on board, sir.
Yeah, thank
Let's just
you.
start with the questions.
Yeah, sure.
Yeah, sure. What's the life of a doctor today?
Well, the life of a doctor today in any field, today in this COVID era, is a COVID warrior. So it's like a soldier at the border. We are the doctors here. We cannot turn our backs to the people of this country, and this is the testing time for us. And we have lost a lot of colleagues, but I'm very proud of all the doctors in India who have done a wonderful job, irrespective from any field. He may be a surgeon, he may be a cosmetologist, he may aesthetic physician, dermatologist, or even MD physician or cardiologist. They are all working hard for the COVID era and saving lives, and they are all coming together as a team. And it's a social responsibility, and this is testing time for us, and we have proved time and again that we have passed all tests.
That actually says how hard a doctor has to work in order to serve the society. That's actually a pretty cool thing because we as engineers, we just sit here, just code day long, and we just don't realize what's the actual hardware which takes for us in order for the doctors to generate data for us. I think what is much more complex. Is it a human body or the mindset of a doctor? What do you think? What are your views on whether human body is complex or the mindset of a doctor?
Complex situation, it's a situation. Complex is a situation. You have to keep it simple. Okay, you have to follow the rules, you have to follow the protocol, you have to follow the white papers, you have to have your instincts, and you have to see what is best for the patient. Complication is when you are not organized. If you're organized, there is no complication. Human mind and body is very, very simple. Keep it simple, keep it straight, and don't manipulate. That's how you live life.
We intend to manipulate a lot of things: money, fame, name, even our lives sometimes. If we want to be friends with others, we tend to manipulate a lot. But
Absolutely.
I just want to ask you one thing. You have been doing courses in Edureka and you've also been certified from Harvard and MIT for the IPS certification. General question: as an engineer to a doctor who is learning the machine learning and the AI, do you think TensorFlow can change the phase in which medicine is changing the world? Absolutely or not
Yes.
absolutely? That might be your view, but yeah.
See, TensorFlow will change things depending on the medical data and the data that you collect. Okay, let me tell you, machine learning or artificial intelligence for doctors probably Let me tell you two perspectives. One is a doctor's perspective and other is an engineer's perspective. Okay. For a doctor's perspective, artificial intelligence, machine learning, everything should be more of a scripting language. Okay. They should not get into programming. They should just understand Python. They should just understand what is predictive analysis. They should basically understand what are numpys and arrays, what are pandas and data frames. And they should understand, basically, they should pro- pick up a field of data visualization. So, for example, a doctor wants to do Python scripting. He should learn a doctor wants to do Python scripting. He should learn basically advanced Excel and visual basics of Excel. He should have basic knowledge of SQL, and he should not get a little of math. If you don't know math and statistics, you should do a short course of statistics, maybe from Khan's Academy or somewhere, and then get into artificial intelligence. And at the end of the day, only data visualization and probably something like a Tableau or the business intelligence like Microsoft, that is known as a Power BI from Microsoft, would be the ideal course they should do so that they can visualize the data. And in their daily clinical practice, they should know what is the predictive diseases that are upcoming for this lifestyle of this patient. And they should not get into programming, because coming back to programming, it is a part of the engineer like you. So what you have to do is you have to collaborate with the doctor. Just see that he knows the basics, the scripting and basic Excel, advanced Excel, and basically data visualization. And programming and coding remains with you, because if they get into coding, they will lose their basic domain of the medical knowledge. So we should both not cross the bridge. We should not overlap our, it's known as roles and responsibilities. Do not overlap your roles and responsibilities, so that there is no conflict of interest. Okay. For my side, I am understanding the whole concept of artificial intelligence and machine learning, but finally I will close down at data visualization, Tableau, Power BI by Microsoft, and probably understanding the Python scripting and predictive analysis. I am not getting into, of course, TensorFlow is a lovely platform. I love it, and in fact, Keras is also very good. If you see Keras, but the problem is how many things can you do at a time? You have your practice. I think this should be enough to help the IT industry and the engineer to get the perfect, accurate model of the program or the app that is required for the present scenario in this global scenario of the pandemic. And not even diseases, we can look at chronic diseases, acute diseases, or the upcoming acute conditions or the pandemics. We can do everything if we know where to draw a line between the engineer and the doctor.
Yeah, that actually clears a lot of doubts what engineer's role and the doctor's role will be in the future. Thank you so much, sir. Let me just ask you this question, because you are an aesthetic doctor, an aesthetic family practitioner. I would just love to ask you one question. Is it the aesthetics or the genetics that matters? What's your view?
So, what do you understand about aesthetic and genetic? Is genetic for an esthetician is more about the ethnicity. Okay. So, it's about which ethnic group. For example, for an aesthetic doctor, he has to understand whether the patient is an Asian, a Caucasian, an American. If he even he is an Asian, let me tell you the complication as genetics is concerned. If he's an Indian, then probably there are 27 ethnic groups in India. If you do aesthetic procedure in a North Indian, they want a round face. Okay. If you do aesthetic procedure in the South Indian, he wants to be fair. Okay. If you do aesthetic procedure in the west, that is Maharashtra and Mumbai, they want to have a chiseled face. Okay. If you do an aesthetic procedure in the east, they want a round face. Okay. The problem is beauty is a perception depending on the ethnic group. For example, if you go to a Mongolian, okay, they want a square face. A lady wants a square face. Okay. So the Indians won't like it. If you go to Korea, they want a round face. So the beauty of the face basically is a perception which goes with genetics, with the ethnic groups they belong to, and the familiar people they are around them. So you have to first study they are from which ethnic groups, they are what age groups, and they are from which area of the world, and they would like to have a final look of from where they belong. So genetics plays a very big role as ethnicity, as well as the age factor, as well as probably uh, the overall perception that that person. So there's something known as goal setting. That means what a doctor wants to give the patient and what the patient wants are two different things. Unless they don't come on one page, that is known as a goal setting. The goal setting is achieved when what the doctor wants to give and what the patient wants are one.
That's true. That's true. Because when we interact with a lot of people, there are a lot of requirements that are required. Even for a client who just comes to us, he asks for a different thing. He might be looking
Absolutely.
for the aesthetics. He might be looking for the perfection in the algorithm. As a decision scientist, some people give out different algorithms as an approach. As a lot of things are happening. So,
Absolutely.
as an aesthetician, you have been seeing a lot of therapies which has been developed and a lot of technologies which are being involved. Let it be cold laser, let it be any such technology which is coming up as a new trend now. What will be the trend of the medical science tomorrow? Even if will there be a trend where the cancer can be removed through a non-invasive fashion, through a robots or any other means? What's your view about what's the potential that this technology with a mix with the medical field and mix and match of medical field and a mix and match with the algorithms, what are they going to be in the future?
So coming back to oncology, okay, let's go with oncology. So oncology has a lot of aspects, like you have a family history of cancer. Okay, so people like you as engineers would probably help us with the coding and understand what are the predictive diseases that are prevalent in that family. Okay, and we do the statistics and the probability. Okay, and you know what is the residual, right? So the margin of error and the residual that you do probably, and the range, I hope you understand what I'm talking about as far as the
Yes,
engineer is
sir.
concerned.
Yes,
So
sir.
coming back to the medical field, you might have a family history of cancer, so you know that this person might get cancer sometime in life early. And so lifestyle like smoking, alcoholism, stress factors, they might play a big role in getting the cancer to that person. But what we could do is we can change the lifestyle of the person. We can take a holistic approach. You can give them a program wherein probably if these are the do and don'ts, if you follow this, your risk factors are lower with respect to others. And get yourself tested and scanned every 5 years after the age of 40 is a good idea to keep away from this cancer. So as far as preventive is concerned, the biggest role that will play in the future, as you asked the question, is the preventive oncology is the future. That means once the cancer happens, then it is the lifespan, probably, that is life expectancy is 2 years, 3 years, 5 years, and there's a lot of financial burden on the family of lakhs and crores of rupees for the medication. So I think people like you should take a step forward and ask the doctors to talk about family history and predictive analysis, help them with your programs, so that the patients that come to them probably would understand that maybe if they continue this in the next 10 years, they might suffer from this because X in the family or obesity or any other factor could affect them. So you are an alarm. So you can raise an alarm, you can raise a red flag and say, boss, look here, this patient has to stop here, and the doctor then interprets in the medical language, and you both are on the when you both are on the same page without a conflict of interest, I think the patient will have a longer life in oncology.
Yeah, that's actually gave a lot of things as an insight, as an engineer and a doctor, how we can interact in the
Absolutely.
future. Like
You have a
I
very
just,
big role.
yeah, I just want to ask you one question. On this has been in my mind for a longer time now. Medicine has been developed in such an advanced environment, the most cleanest environment that you can think about. But even today,
Absolutely.
there can be a drug which can cost you $10,000 or maybe, but everything comes with a side effect. Like every dance has its cost. When you start learning in a similar fashion, every drug has its side effect now. So, what's your view on that?
So are you married?
No, I'm not married.
So you will come to know that marriage also has side effects. So my my answer to you is very simple. There's always a saying. There's something, a word known as placebo. Placebo means I shall please you, a drug which is just given to a patient without, it's a blank drug. It's known as a placebo. Now, when you give a drug to a patient, there is a saying in the medical field, a drug which does not have a mild or moderate side effect is not a drug at all. Okay. It is not a drug at all. Let me tell you. Second thing is you should know how to handle the storm. Same way you should know how to handle the side effects. You should know what dose should be given. Side effects are a part and parcel of your life. When you cross the road, 1 out of 100 times there's a chance that you'll meet an accident. That doesn't mean you'll not cross the road. Same way, if you have a acute condition like a stroke or fever, when you have a stroke also, when you give a bolus of altiplase to the patient as a stroke therapy immediate in the golden hour, in the first 3 hours, if there is a 5 to 6% chance of bleeding in the brain hemorrhage, that does not mean that drug cannot be given, because there is something known as beneficence versus maleficence. That means benefit is more than harm. I know the drug has side effects, but a doctor will give the drug when the beneficence is more than the maleficence. That means benefit is more than harm. And let me tell you, if you can tame a lion, you can tame the side effects of a drug.
Yeah, that actually cleared my doubt in a very short span of time.
Absolutely.
That actually cleared a lot of
Absolutely.
doubts that I had. Sir,
So,
I have been seeing a lot of physicians who do a lot of diagnosis in oncology also. That okay, diagnosis might not happen in a good fashion. According to you, what can give the best diagnosis result? What should be the approach in order to get the best diagnosis result? Let it be skin
so
cancer, let it be anything that you see as a patient. Let's just say you have a patient in front of you tomorrow and he is suffering from cancer, but you can't say it to him direct, or you can't grab the information from him direct. What can be the actual approach in order to get the right diagnosis?
So the right diagnosis is only with two things that comes. One is experience and other is technology. Okay. What is experience? A doctor who is well experienced and well read and has a good clinical approach will always give the best. Let me tell you one thing. No doctor in this world wants to harm the patient. He always gives his best shot. There is a misconception that the doctor has harmed the patient. There's nothing like that. The doctor is the only person in the world who will always think good of the patient, whether he pays or he doesn't pay. So the clinical experience of the doctor, and if he's well read, he'll have an excellent diagnosis. But today, if technology is backing him up, the accuracy will be 100%. So you people with technology and doctors with their clinical experience and well-read knowledge can make the diagnosis more accurate and better quality of life for the patients.
Yeah, that actually says that we we as you as a doctor has no part in the death of the person, but as a doctor your job is not to just cure him from the disease, but also give him the right potential or the right essence of mindset to cure from the disease. That's actually clears
Absolutely.
that actually clears a lot. So there has been a lot of ways in which diagnosis are happening. What are the setbacks that you feel today in India that we lack in order to diagnose faster? What's your view?
So my interpretation, what do you mean by diagnose faster? Is it diagnose earlier or is it diagnose faster?
Diagnose earlier and diagnose faster, because a simple SPECT scan will take days for getting the result. Also, might be there are processes in which people are not interpreting in a right fashion, and this has been discussed in a lot of papers also. Even if we see Mary Tinnett's paper, she says that it's been underdiagnosed or undertreated, mistreated, or overtreated. There are a lot of concepts which just come out, and there are a lot of things. What do you think that India has that setback in order to give the diagnosis faster, quicker, and more accurate?
So basically, we have challenges in the healthcare field. So the GDP budget of India for the healthcare field has to increase because we do not have budgets like the US or UK or developed countries. We are a developing country. We have limited resources. But irrespective, if you ask the whole world, even if you go to Dubai or US or UK, they will say undergraduate studies of a doctor are best in India because we have so much exposure to the patients. That is first part. Second part is about early diagnosis. So the days are over where we do not do early diagnosis. Now we do really very early diagnosis. And how, I'll tell you, if you do a CT scan of a patient of an MRI, you just check with Philips or GE, you see the artificial intelligence platform they have. The CT scan report you get in 1 hour, and MRI report now, the new MRI report, the 7 Tesla that is coming out, that report will be out on the same day. And when it comes to your PET scan, even if you go to hospitals like Nanavati or Lilavati, the PET scan report you get by evening, and immediately on the spot they can even give you a handwritten report. So as far as early diagnosis is concerned, yes, early diagnosis is not a problem. The problem is the patient reaching the hospital on time is a problem. The patient connecting to the doctor on time is a problem. The patient getting awareness is a problem. And that is where you people come in the picture, where technology will create more awareness, easier accessibility, and early treatment for the patients. But doctors are ready to give early treatment provided the patients reach them out. We don't have a telepathy that in the next cross lane a patient has got a heart attack unless a technology button is there with him which they press and we are there in 5 minutes. So you are the heroes of this, where you will let us know where we have to reach or where the patient has to reach. So once you come out with those platforms, probably it becomes easier to give better quality of life and treatment to the patients. So earlier the better. That's why we are getting more into the IT and the intelligence platforms like machine learning, so that we can predict diseases and we can understand. For example, a person having a very high homocysteine level has a high chance of stroke, so we already give him medication for reducing the homocysteine. Somebody who has a high triglyceride, cholesterol, and low LDL in the blood, you know that this patient is at a very high risk. So you treat them early. So how do you do that? You do that through electronic medical records. Like we have a very nice naturalminds.in spot care. Spot care is a new artificial intelligence software for for the doctors, and now they are coming out with a patient care kiosk everywhere. So these are the kind of people who are really trying to understand how they can get better care uh, to the patients, and people like you who can prepare apps for the patients, who can just download it from the Apple or some Android phone, and they can actually know there's an emergency button. So once they press the button, the nearest doctor, nearest map, nearest treatment, who's best at with specialty, all areas belong to you and the doctor together in collaboration.
In collaboration with a lot of doctors, I think in the future
Absolutely.
we as an engineers will make the medicine and the diagnosis much more faster, quicker, and accurate.
Absolutely.
So as you told, there is a lot of things which a technology can have as an field which is not related to medicine, but yet it can be effective here. I just want you to ask you one thing: what's the role of telemedicine and video consulting in the future? Can it really change the world? Because I don't think, even if we are in the front of a doctor, he can give you a complete diagnosis in a very faster way. Like, it might take them days, it might take them hours. Like, how can it be an influence in the future, the telemedicine and the video consulting?
So probably it's for preventive care, telemedicine, and what happens if a person wants a consultation for the first time. So telemedicine is, as I told you, the spot care program that is there. If you see the EMR records and the IPCP intelligent platform by Natural Minds, so it gives you a video consultation with the patients, and probably it has a diagnosis over there. It has options for medication also and investigations also. Everything is there with the complaints. So the for the first time the patient can, with this COVID era on, I think telemedicine is probably a blessing in disguise for doctors also and for the patients also, because there's a chance that suppose a patient is just having some cold or cough or some basic condition which is not acute and doesn't require hospitalization. So telemedicine is the way forward, because unnecessary your traveling time 1 hour, and then after that sitting in a clinic for 1 hour. But if the doctor is getting the same amount of money through telemedication what he's getting when he reaches the clinic, he can always call the patient for follow-up if he requires to examine him personally. But unnecessarily examining him for the first time, he could do it on the phone, and he could get the same amount of money, unless he feels, no, I want to see this patient personally because I feel there's something really wrong with him, or I need to get him hospitalized, or any other reason. But unless that is not required, at least younger generation patients under the age of 30 or 40 or 50 can get into this telemedicine, and especially those senior citizens who are staying alone, and their children are abroad. They, for them this is a blessing in disguise, because they might require the doctor every day. So every day they can't go to the clinic. So what happens, they have just to press a button for an appointment, and the doctor gives them a time, and they talk to him for half an hour. And in fact, let me tell you, senior citizens feel good even just talking to the doctor and not with the medication. So most of the patients in this world get 50% all right only by talking to the doctor and seeing his face. So in telemedicine, a video consult is a boon, not the audio. So in any case, once he sees the doctor, he's 50% fine. So my question is, telemedicine has a huge role to play, especially in this COVID era, because it's a contactless program. Okay. In fact, this is a risk-free program. You should move this telemedicine to the next level, wherein you will also have regular alarms and alerts giving to the patient that if he has any urgent problems, he can contact such doctor or such hospital directly, and without wasting much time. As you rightly asked the last question, if they reach on time, the treatment is proper. If they reach late, the outcome is poor. But if you diagnose something very early as a predictive disease, then you are god for them.
Yeah. There has been a lot of speculation that AI might take the job of an engineer. What Vinod Khosla had said 20 years before. He had openly said that it might take, but it's not, because doctors are somebody where we as an engineers might not have the clinical knowledge. Doctors are supposed to be there in order to give us the clinical guidance. I think with this podcast, I think probably this covers the 25% of what the podcast was supposed to be. I think 75% is supposed to be done in the part two, sir. I think we'll just do that.
Absolutely.
We'll do that in the next week or so. That's for sure. Sir, I
Absolutely.
just want to ask you one question. What's the role of AI in the present world? And also, what should be the approach of an engineer, according to you, in order to solve the problem in a very fine tuned fashion?
So for an engineer in artificial intelligence and machine learning, I'm looking forward for them not getting into too much into scripting and operational part of the software for the medical field, because leave that to the doctors. I'm looking at more for them in coding and programming and giving better
The right
platforms
algorithm.
and a quicker right algorithm and proper platforms to the doctors, which is user friendly. That is one. Second, uh, I have a very big concern regarding the IT and the AI coming in. I need 50% of the engineers to get into cybersecurity, because the biggest problem that we will face in the future is cybersecurity regarding confidentiality of the doctors and patients and hacking. We do not have enough people. We will be short of at least 10 million cybersecurity engineers in the next 1 year. Okay, so you should understand that you are the backend people who are going to debug, who are going to maintain the confidentiality and hacking. And there is something known as ethical hacking. Okay, so you should be one who should do ethical hacking and see that nobody is abnormally hacking the sites and spoiling the tempo of the patients and the doctors. So you should become the policeman of the engineer should become the policeman of the medical field, wherein they will guard all the apps and all the platforms and all the AI and ML and deep learning and reinforcement learning, structured learning, unstructured learning, everything that is there should be cyber securitized by you.
Thank you for this amazing talk that you actually gave for us. I think this part one is absolutely good enough for us to start the a challenge of me getting inside the data sets and also working on the melanoma data set.
Absolutely.
Thank you so much for this podcast, sir. It was amazing speaking to you. And I've never seen any
Thank you.
doctor praising an engineer for the trend which we are creating.
I am praising an engineer because I am selfish. I
Thank
want
you,
you
sir.
to understand that because of you, if you guys do the right job with cybersecurity and programming, we would be good enough to treat the patients well with AI and ML, that is artificial intelligence and machine learning,
Yes.
and the telemedicine software with the video consultation. And it is going to be amazing working together, collaborating, provided we don't overlap our roles and responsibilities.
Thank you so much, sir. Thank you so much. It was good to have you in the
Thank you.
podcast.
Thank you. Thank you. Thank you.